What is a coronary artery calcium test, and should you consider getting one? We do annual mammograms looking for breast cancer and routine colonoscopy, but the leading killer remains coronary artery disease. And advanced imaging has recently allowed us to detect it decades ahead of time and do something about it. The scariest thing about heart disease is that most patients had no symptoms prior to their event, and many hadn't even seen a doctor, didn't have risk factors, and most were on no preventative therapy. But our current health system encourages no significant preventative therapy until you're having symptoms, and it's often too late. So instead of relying on statistical models that work in populations, individuals have taken a more personalized approach by scanning their coronary arteries for the presence of plaque. And it turns out that measuring and quantifying the degree of plaque present correlates with cardiac events in the future, with numerous research trials showing that a score of 0 is favorable, whereas higher scores are associated with increasing rates of cardiovascular events and mortality. In fact, your total plaque burden seems more important than how many vessels are narrowed. It's a very simple test to perform. You don't even need a gown or an IV. You just lay down and hold your breath, and the picture is taken. In fact, 52 mummies from as early as 1500 BC have been put through the scanner, and 85% of them were found to have coronary artery atherosclerosis. And the X-ray exposure from the scan is minimal, equivalent to taking a trans-Pacific air flight or two. We know that higher calcium scores are associated with adverse events, and a calcium score of 300 is equivalent to having already had a cardiac event. And you can go online to determine your risk of a cardiac event based on gender, age, ethnicity, and calcium score. You can assess your coronary risk against age-matched controls in databases. The finding of any coronary plaque indicates the need to drive the LDL as low as possible to stop plaque progression. In fact, when we see plaque, we encourage you to stop smoking, control the blood pressure, get the LDL less than 70 and ideally under 55, get the ApoB under 80 and ideally under 60, check an LPA level, and a diabetes risk index for insulin resistance. Get a DEXA scan to minimize visceral fat, and check VO2 max to optimize fitness. Now, one caveat to the calcium scoring test is that a score of 0 is reassuring, but not completely so, and can be falsely reassuring, in that the risk of heart attack still exists. So particularly if you are under age 50, have diabetes, or any symptoms of chest pain or shortness of breath, further testing is indicated. In fact, an important Danish registry showed us that amongst folks who had had a calcium score and were followed for 3.5 years, 31% of the people that ended up having a heart attack had had a calcium score of 0 just 3.5 years earlier. Which brings us to the important advance of ultra-fast CT coronary angiography, which can give us closer to 100% confidence that a heart attack will not occur in the next 10 years with 0 plaque detected. Ultra-fast CT coronary angiography is a tremendous advance, and if affordable, tells us much more about your prognosis. We were also initially confused when we started to see that lipid-lowering therapy with statins and other medications actually paradoxically increased calcification scores, until CT coronary angiography taught us that statins and other lipid-lowering therapy was converting soft, lipid-rich, vulnerable plaque into hardened, calcified, stable plaque, which was helpful for patients. This highlights why, once you've had a positive calcium score, there's no point in getting another one, because progression will occur, and we can't tell if that's because your plaque is worsening or in fact treatment is hardening and stabilizing the plaque. And because the calcium scoring test can't tell us whether the plaque is growing outward or growing inward and narrowing the vessel, which can impair blood flow to the heart muscle, a phenomenon which we describe as positive or negative remodeling, it's important to follow up your anatomic calcium scoring test with a physiologic stress test or perfusion scan that can tell us whether that plaque is narrowing the arteries and needs intervention with coronary stenting or bypass surgery. Given our healthcare system's focus on end-stage disease and failure to capitalize on prevention, consider taking charge of your own coronary prevention by starting with the coronary artery calcium scan. I'm Dr. David Hinchman, cardiologist and co-founder of High Desert Heart and Vascular, with this cardio tip.